The requirement for electronic visit verification, EVV for short, comes from the Cures Act, a United States law enacted way back in 2016.
Now, this isn't to be confused with the CARES Act, which came about as a result of the COVID-19 pandemic just this year.
Right. That's actually the CARES Act with an A, not the Cures Act with a U.
So if the CARES Act was enacted in 2016, why are we only hearing about it now?
That's a good question, Mike. While many aspects of the law have been in place for a while, New York State has mandated that the EVV provision go into effect January 1st, 2021.
And we all have to comply?
Unfortunately, I'm afraid it's not an option. If my son and all our other participants want to continue self-directed services, we're required to comply with these new Medicaid rules. They are mandatory for the self-direction program, as well as for all other Medicaid-funded personal care and home health care services.
So Liz, what exactly is the point of EVV?
Well, the New York State program guidelines state the goals of EVV are to ensure timely service delivery for members, including real-time service gap reporting and monitoring, reduce the administrative burden associated with paper timesheet processing, I like that, and generate cost savings from the prevention of fraud, waste, and abuse. And here, as a parent, I think is the real benefit. It aims to strengthen quality assurance by improving the health and welfare of individuals through validation of delivery services.
So real time, that means staff are punching in and out exactly when and where they begin and end their shift, right?
Yes, that is correct. Real time is live, when the support is actually happening. To me, it sounds like this new rule will help protect our participants in many ways.
So, as an FI, just like the staff, ISS doesn't have any choice but to follow these rules, correct?
That's right, Mike. In order to keep acting as our participants' FI, ISS, along with all FIs in New York, must comply with EVV. It's a huge task, but we're up to it, and I know our participants are too. Just to review for some of us, let's walk through how self-direction funding works. Our federal dollars help fund part of Medicaid, which pays for self-directing services. The federal government enacted the Cures Act, and then the New York State Department of Health interpreted and implemented the Cures Act.
And New York State provides the rest of the funding for self-direction programs, right?
That's right.
Support staff are hired by our participants to provide home and community-based services, but the participants don't pay them directly. Their staff get a paycheck from us at ISS.
Yes, and once ISS has paid the participant's support staff, ISS invoices Medicaid on behalf of that participant. This is why ISS is called a fiscal intermediary, or FI.
So, based on everything we know so far, it sounds like EVV applies to support staff services delivered in the home and community. Is that right?
Exactly. The specific rules state that all ComHab and respite services for which an FI directly bills Medicaid must be using EVV, electronically verified visits, for staff time. In the state of New York, the general location that a staff begins and ends their shift must now be reported in order for the FI to bill Medicaid for that service.
Yes, we don't have to report their exact location. In fact, what we report to the state is only either home or community.
That's right, Mike. So now, how can ISS possibly know if the staff are starting or ending a shift at the participant's home or in their community?
Could I, as a staff, just tell you where I'm starting?
Unfortunately, no. Any viable method has to be electronically verified. We cannot just accept the staff's word on their location at the beginning and end of their shift.
So there are a few ways we could have accomplished this, but what we selected is called geolocation, which uses a mobile website and an app, which we currently have in development.
So what's geolocation?
Simply put, it's the technology that allows your phone or other device to give you directions on your maps or tell you the nearest store location.
Oh, so that's that pop-up question that sometimes appears when I'm searching for something on my iPad or phone. It gives me the option to allow or don't allow my location, but does it work on all devices?
Yes, there are a number of different ways that a device determines your location, but location services work across any modern internet device, such as phones, tablets, and computers.
So for eTime Live to work, support staff need to always click Allow when they're clocking in and out.
Yes, in order to use eTime for EVV, support staff will need to allow location services for the ISS portal or the eTime app.